dear President of the panel, excellent member of the panel, morning. I'm Kambale Kande Zefani. I want to present my work, which the title is Etio-épidemiological clinic and therapeutic profile of fevers in children aged 0 to 11, 50 years, received in the pediatric department of the Clinique Universitaire de Graben from January 1, 2014 to December 21, 2017. Will the outline is introduction, the motives, methods, results, conclusion, and suggestion. Introduction. Fever is a rise in core temperature above 28 degrees Celsius in the absence of strenuous physical activity in a child normally covered in a room temperature. The fever is experienced in a very anxious way by the parents who don't hesitate to consult at the slightest fever peak. Morbidity and mortality linked to febrile illness in the third world countries occur in an environment characterized by a low socio-economic level and by a population with a large young fraction. In France, fever is the most common cause since it represents 20% of consultations in children under 2 years old in pediatric emergencies. The WHO report in 2007 mentions malaria, acute respiratory infections, and measles as the main causes of death among children in the Democratic Republic of Congo. Motives. The child's fever is a beneficial reaction of face of organism against an aggression. However, it is an agonizing or jeopardizing symptom for parents. For this reason, fever is the most frequent consultation motive in pediatrics. It has several origins that are necessary to know in time. Infectious illnesses are often the more incriminated. This work aims at reviewing fever causes for children from 0 to 15 years old consults at the Clinique Universitaire de Graben in its pediatric service, indicating how they are coupled with objectives. Our objectives are to determine the frequency of recorded febrile illness, to identify factors that caused fever in children, to determine the clinical signs associated with fever and the paraclinical examinations carried out in the event of a febrile attack, to evaluate the care of the febrile child by nursing staff. Methods. It is a retrospective survey done at the Clinique Universitaire de Graben since January 1st, 2014 to December 31, 2017, taking into account 1,312 patients selected among 2,341 hospitalized children. The sample was exhaustive. We consulted the films of the patients and the registers of the hospital from gathering data. The treatment of the data has been achieved thanks to the software PFO, MS Suite, and MS Excel. Results. Among 2,040 and 21 children hospitalized in pediatrics, 1,312 attested fever, that is a rate of 53.97%. The masculine sex predominated over the feminine sex, that is 52.36% against 47.64% feminine. The age group which is more touched by this issue is the one between 1 month and 2 years, with 52.59% of frequency. Fourth, the isolated fever is the main motives of precipitation. In this respect, the white globule enumeration, the leukocyte formula, the tick drop, and the Widal are the main paraclinic exams. The main causes of the fever are respiratory infections, followed malaria, and gastroenteritis, digestive parasites. Finally, antipyretics and antibiotics are the most used medicinal products. Conclusion. In the current economic context, the prevalence of the principal fever cause diagnosed in our study are constituted the best therapeutic approach. Suggestions. We suggest to nursing staff to administer the antibiotic in case of fever after identification of the gene that we want to attack. Parents not to use antibiotics anytime once fever sets in, to avoid germ resistance to antibiotics. Excellent President of panel, dear member of the panel, we are at the end of our presentation. Thanks for your attention.